system, and I'm going to read a little legalese for you here. I want to welcome you to our face-to-face and virtual town hall. Please be aware that this is a public forum that extends to in-person, online, and that comments can be posted in the online chat box. Please be aware that any individual and media present can quote you in a story or on social media. If you do not wish to be quoted or recorded and you have a question, please make that known before you start speaking. We will begin the town hall with the Pledge of Allegiance, followed by updates from the VA Eastern Colorado Healthcare System and Colorado Department of Veterans Affairs. We expect this to be interactive. I would caveat that you should not speak about your personal health information in an open forum. We have team members standing by who are able to assist you with any personal health matters. If you have a question you feel wasn't resolved, please see myself or Dustin, Victorine over there, Dustin, and we will get your contact information and we will have one of our team members follow up with you. On behalf of Michael Kilmer, Director of the VA Eastern Colorado Healthcare System, and David Callahan, Director of the Colorado Department of Veterans Affairs, I would like to extend a huge thank you to all of you who are attending in person and online. And if you would please rise and join us in the Pledge of Allegiance, led by one of our nurses. Thank you. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you so much, Elizabeth, for leading us off. It's great to have one of our local nurses here with us. And I want to thank David for joining us from the state. This is the first time that I'm aware of that the entire VA team has come out. So we have VA healthcare, we have VA benefits, and we have our vet center, and we have our state partner here. So if you have any needs, as Terry mentioned, along this back wall over here, we have people from enrollment, people from community care, we have social working caregiver, we have our homeless program, and many other, in mental health. We have a lot of resources here, so if you do have an individual issue, they're standing by to directly help you. So tonight, I just want to provide an update. As you know, I've been traveling out to meet with local hospital leaders and local elected officials in our clinics. Now this is our 4th visit out. This is our first town hall that we've been able to open up in this format because of COVID restrictions. The previous discussions, that's what I want to give you an update on, because I know a lot of people are concerned about the errors or the market assessment, and the recommendation, just to remind you, it was to transition all of the care locally to the community and to close Burlington, Lamar, La Junta, and Salida. So the Heirs Commission, the Senate has signaled that they are not going to charter that commission, and so without that commission being chartered, it kind of dies on the vine for now, okay? So the market assessment, though, based in the Mission Act, it does require the VA to go through this process every 4 years. So I want to work with the community to get us off that list the next cycle. And so I want to share with you some of the things that we're doing to help prop up our rural clinics to keep them going. Because all of you made your voices heard, thank you, and we know that you want to keep the local clinics open. So what we're in the process of doing, we are part of the bigger Eastern Colorado healthcare system. We're breaking that down into 3 different sectors. So there's the sector that has the northern, basically Denver Metro, southern, we have the Colorado Springs area, and then we're adding a focus on the rural clinics only. And so on the rural clinics, again, those are Burlington coming down south, Lamar, La Junta, over to Alamos, up up to Salida. We're making that its own sector, and historically you would have leadership from the urban areas overseeing those clinics. We're making them their own grouping with their own support. So, Mr. James Crabtree, where are you? Here you are. So, James is our new assistant director for the southern area. Under him, we're going to be hiring an area manager to directly oversee with him and myself and our clinical leadership the rural areas. So within the rural clinics, we are still moving out on hiring, fully staffing those clinics. So for example, in Burlington, we have a full-time medical doctor now, which is the first time in history. And just as a side note, we hired him even when we knew what the recommendations were going to be, because we believed locally it was the right thing to do. Our provider here in La Junta is currently shared between here and Lamar. Our goal is to make her full-time in Lamar, and that will happen when we hire a full-time doctor or provider here and in La Junta. So every one of those clinics, again, we're pursuing a full-time provider. We already have one in Alamosa. Sadly, we need to replace the one in Salida. So you may ask, well, how is that going to work? So when the review comes through, we have to show, obviously, the fiscal responsibility of the clinic. And I believe we can get there, and I'll tell you how we're going to do that. And then we also have to look at the quality and safe care. And if they're properly staffed, we should be able to do that. And along with a high level of service. So most of those clinics, well, the 4 that were recommended for closure, if you look from a pure dollars and cents perspective, which is how it was measured pre-COVID and the data and the recommendations that were what they were decided on, well, a lot's changed since COVID. We've lost a lot of resources from many of those communities, and we need to really reassess. So that's what we're doing now, but we're still moving out on a plan to staff it. So the goal is to take the traditional one-way road, and I'm sure, is there not a single person in here just frustrated with feeling like you have to go to the urban area? And there's that mindset of one-way road from rural to urban. We're going to make it a bi-directional road and have our urban veterans that have better access to broadband, get their telehealth through our doctors in the rural area. So we'll lift up their panels and give them the appropriate number of veterans in their panels to justify those clinics from a dollar and cents perspective. And we still have that need for the urban veterans too, because right now we have a significant shortage of primary care providers. But we're going all in on getting all those positions filled. So we're going to kind of reverse that trend and have our urban veterans again come out here virtually. To better help our rural veterans as well, and the local staff, every clinic now has a site manager to directly manage the contract, because all of these are leased spaces. And so a lot of times the clinical staff were bogged down with dealing with your landlord, basically. So now we'll have someone dedicated just to focus on that, okay? But I think, is there anyone that has frustrations with community care? Yeah, okay. That's a big issue for us, and we're working on it. So if you're at Rocky Mountain Regional, there's actually a dedicated person that you can go into and speak with if you have concerns about community care. So what we're doing is, if you go to USA Jobs right now, you'll see a posting for a community care liaison. So we're going to add a dedicated community care liaison at every one of the clinics, in the rural clinics. So there's a job posting right now for Burlington, in Salida. We're working on the other clinics. That should be coming up very soon. And Fred, how long is that posting open for? I know it just posted.
It closes on 31 August.
Okay, so 31 August. So that position's going to be a pay grade GS7, which is how much on average? Okay, if you could please.
It's going to be
Low 50,000. So that job will be, it's going to serve three purposes. One, it will be a dedicated position in the clinic to work with the provider. So if a veteran comes in and needs an urgent x-ray, if they need urgent labs, that person can put that referral in and get them over to the hospital to get it done, or wherever they can get that done in their community. So that will save the veteran from what's happening right now. If you go into the clinic and the provider needs to send you over, it's usually just go to the ED when that provider's already done a workup on you. So that's bad service and not well coordinated care. So we want to prevent that. We want to be able to send them directly over. So we'll have that person in the clinic directly to do that. The other function that that person will be able to do is if a local veteran has a concern with community care, you'll now have someone that you can go talk to eyeball instead of having to call on the phone to Denver. Okay? So the third thing that person will do is focus on, be a resource hub for community resources. So really know if someone needs assistance with food, or there's food insecurity and they might need referrals there. If they need assistance with transportation or housing, there'll be an initial entry point to help connect you to the right people. So those are the three things that we're looking at that position to do. I don't know of any other VA that has done this, so bear with us as we bring it on board and we, figure out the real role and the supply and demand of each of those functions. But I want you to know that we're invested in making sure that these clinics are running and functioning at a level where hopefully they won't end up on the list again in 4 more years. And so because of how that cycle is going to work, the timeline I'm giving myself and our team is we need to get this in place and we have about 1 year to 2 years to get this going, because we need at least 1 year to 2 years of data to show the people that are going to do the market assessment the next go around that these are highly functioning, high performing clinics. Did I forget anything, James or team? Okay. Any questions on that piece, on that update? Yes, sir.
Ray Wood, Los Angeles County Veteran Service
I
Officer.
thought you looked familiar. Good to see you in person.
So I just have that, of course, I think, once before I'm in Los Angeles County, so most of the other part of I-25, 48 in Mexico. So
Yeah, you're really under Albuquerque.
Right.
But you have the option to come to us. You don't have to go.
I know it.
Okay.
Well, when I was thinking of that, again, you just said earlier, we want to make sure that our clinics stay open. So how do we integrate that? Because I think we're doing that the reason why. So you have Albuquerque, or Rancho, New Mexico, then you got Pueblo. That's the two that you got Muhammad. So you got that in between. I still think that clinics stay open because a lot of veterans like going to that. You know, have a lot of that like in Colorado.
Yeah.
So
Yeah.
how do we work that?
That's a very good question. Yeah. So, what branch of service were you in?
Army.
Okay. My first career was Coast Guard, so I'm going to struggle with an Army analogy. So maybe James, you can help me out, because he's former Navy, and then former Navy enlisted, became an Army officer. So this is my area of operation. So I can speak to my area of operation, And that's what we're doing here. And as I mentioned earlier, we're the only VA that I know of that's doing anything like this. So for New Mexico, we could easily have a conversation with them down there, but I don't have any control over those resources and assets. So, but we can definitely engage them because they are on our southern border. And just like we engage Cheyenne on our north, but they're within my regional commander, VA Integrated Support Network. Albuquerque is under the one that hits with California. So, but we will absolutely engage them in conversation and we'll share with them what we're doing. Now, I don't know what clinics were recommended. Do you know for closure, Dylan?
Right.
Okay.
Saturday.
All right. Yeah, absolutely. He just transferred in from up there. So,
So knowing just that landscape, it's much like parts of Colorado, very rural. And so if you look at the type of specialty services, I'd probably look more on Colorado's side. It's just because the availability may be a great part on this. I'm not saying that because I switched the healthcare system. It's just if you look at that part of New Mexico, they just don't have a lot of services for veterans. So if you look at Raton, and in particular, that particular outpatient clinic, it's out there itself. And so I would say if a veteran needs specialty services, especially if they need to go to the community, it probably serve them in their best interest to probably look at the Eastern Colorado healthcare system. It's just because we have a little bit more expansive opportunity for help our veterans on that side. It helps our numbers.
yeah, does that help?
Yes, it does help. I just want to make sure so when I've already been putting that out there.
Okay.
Because it's just easier.
Yeah.
I mean, it really is.
Yeah.
So, yeah, that's.
And let's take that as an action item, make sure we don't let that drop, follow up with Albuquerque, because we haven't had this discussion with them yet. But, this is all fast and rolling pretty quickly, and this is how we're pivoting, this is how we're justifying it at the same time. So, yeah, don't really shoot the guns like you do when you Coast Guard. So good question, thank you. Any other questions about our strategy of lifting up our rural clinics? No. Debbie, hate to put you on the spot. She can.
Mr. Cover?
Yes. Okay, thank you. So, Debbie Dominic is our new Associate Chief of Staff for Mental Health. And the other thing that we've been talking about is how we can increase mental health services out here. And so we're exploring options there. The rural communities are harder communities to recruit to. But Debbie, one of the questions that was raised earlier, and I want to keep it in a general sense, is the issue of receiving mental health care, and Fred might have to get your help too, but receiving mental health care from a VA provider and by someone in the community, kind of double dipping. And so I explained how it's either one or the other. So Debbie and Fred, I got that right, correct?
Correct.
Okay.
It was related to groups and individual care.
Yeah, this would be to individual providers, not like a group and individual provider. Okay. So
Okay.
the thing that I want to ask is, and Debbie and I were talking about this today, is the VA is really we are absolutely all in on evidence-based practices in therapy, and we need to continue that course. That said, I'm asking the team to become a little more flexible on groups and maybe more supportive therapies while we staff up more providers. Because right now, what's the latest number that vacancies we have for mental health providers? 100 and what?
I beg your pardon?
How many vacant mental health providers do we have right now?
179.
Okay, that's huge. That's across the majority of eastern Colorado. So 80 of those are new this year that have never been filled before. So we have a significant number of vacant mental health positions. We are going out, we're using every flexibility that we can to recruit and retain people to Colorado. And that will include us expanding our peer support groups, but we need to recruit more mental health providers to Colorado, which is gonna be a challenge because there's a lot of burnt out healthcare workers right now. There's a lot of healthcare workers that are just leaving the industry or going into private practice. But the thing we're working on is we're pulling out everything we can for recruitment, retention incentives, and then we can bind people to a contract to service for some time, and if appropriate, student loan reimbursement. And one of the things that gives us an advantage is the VA is the single largest trainer of healthcare providers. So as we train our staff, that gives them hiring preference and we can just bring them right on in. So we're expanding those programs. It's not gonna happen tomorrow, but it's something that we're actively working on. And with Debbie as our new Associate Chief of Staff for Mental Health, she's originally from Chicago, a bit aggressive on getting things done, and I know we'll get it done. So, do you have anything else you want to add, Debbie?
I would like to, thank you for asking. I'd like to share my email address, and for everybody who's participating in this town hall tonight, if you have friends and neighbors that are in the healthcare field and they're interested in working for VA, could you please have them please ask them to send me their resume. Ask them to send me their resume, yes. And I will put my email address right in here.
Okay, great. Is there a whiteboard in here? Maybe we can find a place to write that where it's a little more visible. Okay, let's see. As far as other updates on primary care, same thing, not as bad as mental health, but we have a significant number of shortages there, but we're also moving out to hire and recruit and retain there. And part of that is being accomplished because we are expanding our academic affiliations, because while we have great medical schools in Colorado, they're not producing enough. So we're moving out to recruit people from out of state, from other medical schools, and training them in Colorado. Because a lot of people don't know how amazing Colorado is. And if we can train them here, it makes it easier for us to recruit and keep them here. So we are moving out on that. And we also have just increased our salary rates for physician's assistants. And we're working on options for our nurse practitioners too. So what we're moving out on is to really have a MD or a DO, a medical doctor, partnered with an advanced practitioner, like a nurse practitioner and physician assistant, so we can prop up those teams. But Colorado, this is an amazing place to live, and we have a great quality of life. So I think we can get there in recruiting people in. But our population is booming so much, and especially with the veteran community. One of the market assessment recommendations was to build a new hospital in Colorado Springs. And that AIRS commission, since it wasn't chartered, that's kind of off the table for now. But because that's so close to us out here, I want you to know what we are doing locally is we're still pursuing the other authorities we have to build a healthcare center there. It's probably 10 years out, but we're looking at having a 350,000, 400,000 square foot healthcare center there, which is essentially a hospital without inpatient beds. So it'll have most of what a regular hospital will have, and then we can add a bed tower to it and get that hospital done. But in the meantime, we are moving out. We've expanded our lease options there. We have a lot of people think it's Lindstrom Clinic only. Now we have multiple sites in the Colorado Springs area, and we're decompressing primary care, moving them out closer to the community, and also mental health closer to the community, so we can put more specialty care there to make it an easier access. So if someone does need to travel, there's additional options besides just going to Aurora. And we also are working on expanded partnerships with the Air Force, with DoD, and we're in the process of reactivating our surgical partnership so we can provide surgery on the Air Force Academy. So we're moving out on partnering there too. Any questions on any of that? I did skip on one thing on my thought. So with the primary care teams, we're roughly short 20 teams right now, 20 providers. Our goal is to get that hired and then move beyond that. Because I want to get out of the cycle where we're dependent on other states. They should be dependent on us. So like right now, we actually have 4 primary care teams of urban-based veterans that are getting their care from other states because we don't have enough providers in our state. But we're working on building that. Any questions on any of those topics? Yes, sir.
First off, thank you very much for doing everything you can to maintain the VA hospital here, VA clinic. My question would be, with the market assessment cycle of 4 years, with the lack of providers, do you foresee that possibly being a problem? Because with telehealth and broadband being kind of an issue in rural areas, and we don't actually have a provider here because of shortages, can you foresee that maybe becoming a problem during the next market assessment cycle?
It could be. I mean, that's a reality that we're trying to mitigate against. So, while broadband isn't that strong here in most of our rural communities, we do have the broadband access going into our clinic. And broadband is strong in the urban areas, so it should be easier for them, like VA Video Connect, and taking a video appointment over the phone. And one of the things that came up last night is we really need our communities. If we recruit someone in to a rural community, we really need the communities to embrace those providers and to make them want to stay. Because it's never fun being in that reoccurring cycle where you have providers leaving every 3 years or so. You know, so we got to show them how awesome it is to live in our rural communities. But yes, that is a concern and it's a risk, but I think we can mitigate against it. Did that answer your question?
I don't know if you mentioned your strategy as far as the reversal, face-to-face, you did already.
I didn't name it, but that's what I've been describing. What James is getting at is maybe I did, is the traditional one-way road thinking and making it a bi-directional road and getting urban veterans out here. So through telehealth. So yes, sir.
What about the PCP panels? Can you reduce them? Because I understand they got 2,000 to 2,500 patients.
That's an interesting debate. I would actually submit to you that if you compare our primary care panels to the private sector, they're actually pretty low. The problem is within our healthcare system is, we use the PACT model, the patient line care team model, which in the private sector they call the medical home model. We have to do a better job at making sure everyone on the team is working to their full capacity. Because if one member on the team isn't working at their full capacity, it pulls everyone else down. And we in the VA are pretty generous compared to the private sector, where a lot of our appointment times, like a return clinic visit on average is 30 minutes. A first-time physical on average is 60. you wouldn't really get that amount of time in the private sector because you might have an appointment that total amount of time, but you're spending a lot of it with your nurse or a health tech or someone else serving you. So there's a significant debate in the VA on what the appropriate length of time. Many providers would tell you, well, it's because our patients are more complicated, but I don't think our patients are really that much more complicated than what you see in other federal agencies, like federal qualified health agencies or Indian Health. And there's also, if you're dealing with like women's health or geriatrics, there's ways to give them more time. There are, or if you have someone with a certain disease type, there's ways to give them more time. But someone who's healthy, they don't necessarily need all that time with the doctor. It's about the team effort. Does that answer your question?
No.
No. I'm not, if anything right now, I'll just put it this way. If anything right now, as we fix the teams and build that standardized work, we need to look at how to increase the panel sizes, not decrease. So, yeah, and that's just being honest. And that's where, unfortunately, the business side of it comes in. And the reason I like that MD, and this probably won't work too well here in the rural environment because you're looking at one team. In the urban environment where you have multiple teams, that doctor and advanced practitioner partnership, it's a great model because the doctor can focus on complex diagnoses, and then the doctor and the advanced practitioner can work together about maintaining persistent chronic health issues or reoccurring, lower level minor issues. So, yes, sir. Okay. Any other questions? Yes, sir.
I think young people are very important to the VA. Back in the day, in the early 70s, Fort Lyon would educate nurses' aides, nurses, PAs. I think the young people are very important in our future, actually, today.
Absolutely.
I think a lot of those people did stay in the local rural areas that were trained and continued making careers here.
Yes.
I think that's something that the VA should look into
Mm-hmm.
because a lot of these young children like to stay closer to mom and dad, grandpa, grandma,
Yes.
whatever the situation may be. And I believe it would be a lot more affordable for them too. You've got to stop and look at the finances a lot of these people went through when they closed down Fort Lyon. They had house mortgages, car payments, student loans. All that's very important. And I think that should be looked at also.
Absolutely agree. And that's one thing our healthcare system in Eastern Colorado we could be better at, and that's on our to-do list. To give you an example, when I was the director in Grand Junction, we actually had an academic affiliation to specifically train healthcare providers in the rural environment. That's something as we're stabilizing here that I really want to explore here, see if we can export that here too. So I agree with you, sir.
Thank you.
Any other questions about what we've discussed or any other new topics?
What about education for the doctors? They go and become an MD, spend $200,000-300,000 on education.
Yeah.
If they came to work for the VA in rural areas, is that a possibility?
There's a lot of
their debt?
yes, there's a lot of loan forgiveness programs, and we have in the VA we have a number of programs, not only for doctors but nurses or psychologists. There's a lot of programs like what you're speaking to, and that's what we're looking at. We use that pretty well right now, but we could do better. And I haven't had a chance to read it, so I'm a little nervous about speaking to it. But today it was signed, the new PACT Act, And that is supposed to expand our capabilities in recruiting to rural areas and expand our pay flexibilities. So, but that was just signed, and so you know, once a law is signed, now it has to go through the regulation and policy process, and so I don't know when we'll have that guidance. We're told to stand by, but I think there's hope on the horizon for that. Yes, ma'am.
We're relatively newly retired.
Okay.
But we have a son and a son-in-law. They won't step foot in the VA, but they have VA. How, is there anything, and I know that there are local people around here, even though we haven't come to very long, that are young and will come, and they won't visit anybody from the VA, and I'm sure that there are a lot of benefits that they're not either accessing.
Yep.
Is there any way we can encourage them more to go into a VA and say, you know, this is this person's here to help you.
Yes.
Use them.
Yes. Yes. Do they live in this area?
Now, my kid lives in Central Texas, on the border of New Mexico.
Okay.
Texas.
Okay. Are you more concerned?
But I'm more concerned that we have seen, we came from Fort Woodard. We saw Fort Woodard,
Okay.
Missouri. We saw a lot of young kids being processed out. I mean,
Yeah.
what we consider young kids.
Yeah.
Retiring or getting out after 4 years because of something that had happened,
Yeah.
you know, in combat.
Yeah.
And then being like, I'll never step in a VA.
Yeah.
But they've got PTSD, they've got multiple injuries. And I
Yeah.
know for a fact there are people in this community
Yes.
that
So-
need some kind of assistance that aren't reaching out.
Absolutely. There's many layers to that onion. So I'll share with you some of the things that we can do locally. And if you're willing, we can take it offline and we can talk about having someone outreach to your son in Texas. Because we have a network, I mean, we're very well connected. And if he's recently transitioned, we have a military to VA program that would be perfect to outreach to him and to talk to him about his care benefits and services. So I will not sit here and tell you the VA is perfect. There's a reason in the Mission Act that we have to create and focus on kind of reinventing our services so they're easy, effective, and emotionally connecting with the veteran to our mission. And that's how we're focusing our stuff. So if you know anyone in the community, this year you're gonna see a major change in the way we've done outreach. I mean, look at today. Have you ever seen, has anyone ever seen VA benefits, VA healthcare, vet center, and the state all come out to this community together? We're going to change the way we're doing our outreach. And it's not necessarily about reaching the veteran, it's about reaching the loved ones of the veteran. Because we know through research, it's typically the female head of the household or the oldest daughter that will say, okay, dad or brother, get on in here. Women don't have to be coached into healthcare, generally speaking. And I'm very proud to share with you that our VA healthcare system, the average, if you look at 21% of our enrollees right now in our healthcare system are women. So we're doing a much better job with our women, or they're probably doing a better job in managing us than what we are with our men. So one, you're going to see much more outreach going on. Two is, sorry Dave, I'm cutting into your time. 7 o'clock. And what you described with your son and others, I would love to introduce you to Jessica over here to give you a name and phone number, because what you really described is a conversation to coach someone into care, right? Because a lot of times, and I'm a social worker by background, and I can't tell you how many times when I worked in the emergency site or the emergency department, man, I mean, you always listen when someone comes in, but when a family member like you brings them in, you really perk up because that's just another gut check that this person needs help. And if any of you are concerned about someone that might need that coaching into care, if you are able to get us that information, we can help make that outreach. Because, and I'll tell you, and Greg's on the line, he actively tracks this. If you look at our data, our older veterans are more satisfied with the VA than our younger veterans. The younger and more female you are, the less satisfied you are with the VA. And we have to turn that around. And I think, and we could always debate on the why behind that, but we have to turn that around. That is exactly why we're establishing an aggressive outreach team. That's why we're out here today. And the other thing on the active duty side, that's a big area of concern for me. And we are actually in the process, how many, is it 22 for the VA partnership for suicide prevention? We're hiring about 20-ish people to specifically be embedded on the military bases in Colorado, because we're pretty locked on for if you're being medically separated, if you have an identified mental health issue, we're pretty locked on with those service members separated. We're not very well locked on with all the others. And when you look at the suicide rates that we have in Colorado, something has to change. So I've recognized that, our team's recognized it, DoD leadership has recognized it, and we're actually working on actively hiring VA people to get at the military bases to help screen people with what we would refer to as a psychosocial assessment. But the idea is really about identifying any life challenges early for early intervention. And our team here in Colorado, I can't speak for the rest of the DoD or the rest of VA, but here that's what we're moving towards. So we can identify them. And one thing we know about like Fort Carson, a lot of those guys stay, men and women stay here. I mean, this isn't like San Diego where people discharge and they realize I can't afford to live here anymore. And it's just a different lifestyle here, and people stay here. So we're getting on the front end of that, at least here, we're moving towards that. You're spot on, and we recognize that.
It just seems like if there are people even in the smaller communities, you know, I don't even know if my son-in-law or my son even know where their local VA is.
On the border, it's pretty, I would have to see where they are, but yeah, there's not many right there outside of El Paso, Lubbock, but that's a little more. But yeah, but that's also the point of community care. But then also you get into the cycle of the same challenges we have here. Are there enough providers in the local community? So that's why we need to expand on getting mental health services out. So, and the peer support programs. So, but yeah, let's please, Jessica, let's connect up. So, any other final questions before we turn it over to Dave? And we'll be here. We don't have a hard stop at 6:30. We can go a little over if we need to, and we definitely have the team here that can help out. Yes, sir.
I just kind of want to add to that. I'm a 10-year Army vet, and as a 10-year Army vet, I'll say one of the first things I think of the VA, it's going back to the Army and dealing with the TD and the paperwork and check the block and red tape. So that is kind of a little bit of a barrier there. And you're also younger. You know, a lot of OIF and OEF or Afghanistan and Iraq veterans aren't older, so they don't really need those resources quite yet, but they will be soon. So I think, you know, we have a lot of community leaders here. We have 3 media outlets in this location. So doing our best to let veterans know to use these resources, utilize them, and that way, when they do that next market assessment, it's better off. And then when they do need those resources, they will be there for them. And, you know, it'll benefit them in the long run if they can just go check in, do their yearly checkups. Maybe they really need a lot of help now, but you know, they're helping out, you know, they're helping out their brothers and sisters in arms that served. So I think that's kind of a community responsibility on us, really.
David? Thank you.
Thank you, George. Well, it's great to be in La Junta. We're in La Junta, correct? Sure. All this traveling going around. I get a chance sometimes as a high school football official to officiate games around this area, so I'm used to being yelled at. I know my strengths are. Next week, scrimmage, and then week after that, we start some games. Really excited to be here. We have a slide deck that's going to be coming up here in a second. And you're the first ones to see the slide deck. That's how special you are here in Wyoming. Okay. So with this, I just want to take a moment to break down and have this high-speed Department of Military and Veterans Affairs. We are the VA and D of the VA. That's what I like to kind of say as we move forward here. And as you look at this right here, you're going to see the Division of Veterans Affairs on your left. That's one of the 3 divisions underneath the department. So the way we're structured, we have the Division of Veterans Affairs. We're only 22 strong. So the only way we're able to take care of veterans is with our county partners here. Rick Ward and Ray Odom here. They're 2 of our county veteran service officers that meet the veterans where they are on the ground, out in the communities, connected to the resources. We also have the Colorado National Guard, largest of our divisions, around 5,500, combination of Air, Army, and then we have the Colorado wing of the Civil Air Patrol, and that's 1 state employee. Next, please. What I want to talk about now is as we move forward, is what we do and then how we do it. So what we do is we look at the CRS in our, I'll just go without the slide if I'm not able to move that to the next slide, please. Here we go. Is a further prompt and efficient service across Colorado to all veterans on a uniform basis. That's what we're aiming for. Are we quite there? No, we're not quite there, but this is going to be our focus on serving our veterans. We talk about prompt. That means when you call us, you should get a response no longer than 2 days. Efficient. You shouldn't have to come back a second or third time to fill out some of this paperwork that this young veteran shared with us. So we've identified that. And probably most important, it needs to be uniform. We look at the rural areas. About a couple years ago, we did a study, put together a Tiger team. We had different individuals participate to get their perspectives. We had all our assets, our 6 state DSOs are all in the Denver area. We said, wait a minute, we're neglecting our rural veterans. We listen to you, just like we listen with the market assessment, and that's on hold right now. So good job. You do make a difference. Never think you don't make a difference. Your voice does count. And then how we do it, we have liaison with our counties, which are the majority of our veteran service officers, 86. So 92, we have a total of 92. We have 86 the county, and then we have our 6 state-funded DSOs. We also maintain liaison with our VA counterparts. In fact, when we talk about our regional concept that we went to, the VA, our big brother, we like to call the VA our big brother here on the federal side, is we have office space there for a state regional VSO working right out of there, out of the Rocky Mountain Regional. We also have them in different locations, one in Pueblo for the southeast region. Eric Monsivais is the regional VSO for this area. He has around 12 counties that he's responsible for. He wasn't able to make it due to some family situation. But we also have our conferences that we conduct with our county veteran service officers. We have the responsibility to certify, and then the big VA will go ahead and what we call credit. And accreditation is so important because without accreditation, you're not even legally able to help veterans prepare the forms. So the counties are going to go ahead and appoint, the state certifies, and then we have Big PA is gonna go conduct accreditation. Mainly, that's what we do, is help veterans with their claims. I just got an email driving in here today that we have a program called the National Veterans Legal Service Program. What this program does, it will take any of your Board of Veterans Appeals that are denied, they'll look at them, they'll say, hey, we think we can have success here. They have about 80% success rate, so just in the last couple of months, we've had over $360,000 that veterans have earned going through this National Legal Veteran Services Program. And it's free to the veteran, and it's also, there's no cost to the state. So that's a great program there that we offer our veterans. And this is across the nation you can do it. We just went into a memorandum just a couple months ago with them. That's the initial results we get. Also, we have the Veteran Memorial Cemetery. That's a state cemetery. That's in Grand Junction. I have a slide here a little bit later. I'll talk more detail. A one source, and then the VTF Veteran Trust Fund and Veteran Assistance Grant. Next slide, please. One team, one fight. What we like to say is when I look at it, having served in the Army for about 32 years as a GI Joe, it's all about combat power. It's about your environment and who can help. Well, with six state-funded VSOs, that's not a whole lot of combat power. So our other combat power comes from our county VSOs. It's one team, one fight. VSOs, VSOs, VSO. Some are funded by the state, some are funded by the counties, some are funded by veteran service organizations. So one team, one fight. 5 regions. The next slide, I'm going to show you that. And then we have full and part-time that we provide vouchers through the state. The state has about $1.3 million, and that money will go out to our county VSOs to help supplement. Doesn't pay everything they need, but it supplements the counties in providing those services to the veterans. We have continuing education and certification. Right now, our state-funded VSOs are going through a National Association of County Veteran Service Officers training. You kind of see what our county veteran service officers receive that training firsthand. We also have conferences. We have our next one's going to be 12 to 16 September in Colorado Springs, and that's where we just go over the latest grades like PACT. What is that going to do? The eVest Act, well, once that gets passed, what is that going to do? The eVest is about ensuring veterans a smooth transition. Currently, as it stands, when a veteran leaves, they have to opt into VA. With this eVest Act, once that gets passed, they have to opt out. So we get them into the system. That's huge. There's about 200,000 service members that get out of the services each year. Some of those come to our communities, even to Junta right here. I already talked about the National Veterans Legal Services Program. And what's great, part of one team, one fight in the counties, we are going to host a national conference for the County Veteran Service Officers in Denver, Colorado in 2024. So we're really excited about that. And then I'm trying some of the evil plans, trying to get the directors, state directors here in about 3 years. Next slide, please. Here are the 5 regions, as you can see. The challenge is with San Luis Valley used to be in the southwest when we first got the napkin at lunchtime, right? We were figuring out how we're going to draw the boundaries, like we do have some conflict sometimes. We found out, guess what? When you go over Wolf Creek Pass in the winter, I don't like doing that. And neither do the veterans that live in San Luis Valley. So they're going to come out east in San Luis. Is that the pass that we have there? What's the pass we have? In San Luis. That pass is a little bit easier. At least it was for me going through there in the winter. So we decided to make that part of from the feedback we received from the communities. And then we have up in the northwest there, that's located, the regional VSO is located at the Western Region 1 source. And one thing we're trying to do next, and this is going to be something I want to get accomplished here before I end up going on to retiring, is we have the Western Region 1 source that's out in Grand Junction. We took it all readiness center, get ready to demo it. We got $3.5 million from the state, renovated it, and now we have a facility that's opened up in 2019 that served 15,000 veterans in that short time. So we want to try to replicate something like that here in southern, southeastern Colorado. Is that in Pueblo? Is that in Malanta? Is that in Trinidad? We really have to look at the need. We're conducting an assessment now, but I'm really going to push to get a one-source center in the community like we have out in Grand Junction. We have a lot of services up in Colorado Springs and up in the Denver area. We need something here in the south. So I'm going to be this one team, one fight, working to help that come reality here in the southeastern part of Colorado. And here's another thing this map shows is we have some of our veterans in that red area, southwest, they'll go down to Farmington, right? We have some go down into Albuquerque, and then in the north, and some of them go up into Cheyenne. That's a very interesting question we had about how that works, because we are one team, one fight, and we want to do what's best for the veterans. So I know we're going to take a hard look at that. And one reason we put the Western Region One Source in Grand Junction, we have veterans in Utah who come over to Grand Junction. And we have things like a DEERS. If anyone knows what DEERS is, it's about ID cards. That's tough. So in Grand Junction, you have to Salt Lake City or Denver. We have a DEERS operator. So it's a federal machine with a state paid, state funded FTE. That's something we heard the need. That's something we did to help fill that. And then you can look at the green area. We have up by Greeley, Windsor, a readiness center. That's where another regional VSO is. I said Rocky Mountain Regional in Pueblo down in the south. And Durango with VOA. Next slide, please. Well, don't go to the money slide. That's going to blow your mind. You didn't see that slide because the next slide is going to blow your mind. So I want to make sure you're ready for it before we get to it. When you go to our site, you do Colorado, DBA Colorado. It's going to come up and you're going to see administrative offices. You're also going to see contact your county VSO. When you open that up, each of these county VSOs will have contact information right here. We encourage you to go see your county VSO first. Because they're the ones you can have face-to-face contact. I know myself, a lot of veterans like that face-to-face contact. And that's where we develop those relationships. Okay, are you ready for the money slide? Okay, it's probably going to blow your mind, but here comes the money slide. I want anyone to tell me what they think this number is. Next slide. Okay, it's called OPM funds. Anyone familiar with OPM funds? Other people's money. That's right. So do we have any commissioners here today? They like other people's money. That's a real big number, and I was part of the Chicago public school system, but that's a lot of zeros, and I believe that's a billion, right? $442 billion. What do you think that number represents? Anybody? Is that why you said it in front of the class? You can answer all the questions? We have a thing called the VA Geographical Distribution of Expenditures, VA GDX. You can put it on the phone right now. You're authorized to go ahead and bring your tablet out if you want to try this out. You go up there, and this is VA expenditures at the federal level. That's a lot of money that's going out to our veterans in serving and assisting our veterans. Next slide. Here's a breakdown. It's going to show, this is fancy to show by state. In Colorado, we have about 387,000 veterans is what you're tracking. There's many different sources that will say some of the rural areas, especially up in some of the ski towns, you have a lot of veterans, but they're not in the system because they don't need to be in the system given their financial position in life. So that's kind of interesting. But what happens is boots on the ground. One of the reasons we went to the regional concept, besides the feedback we received from everyone, is that we want to get out. 50% of their time is out reaching out, developing relationships, and finding out what the needs are for those communities. And if you go to the next column, or comp and pen, the third one, you'll see how much money is coming in to Colorado. $4.2 billion comes into Colorado. If you break it all the way down, you can look at your county, you can also look in districts, in congressional districts, how much money is coming in. It's a lot of money, so the more we get in VA, the more we can help. So what I would say for the younger veterans, okay, you're not missing a leg, you're not blind, you're not burnt. Maybe you have a hearing issue, but it's not a big deal. Get in the system, because if we get in the system, that's more funds that can help out those veterans that are missing limbs and eyesight and burn and so forth. So let's get our battle money in the system. And I'll tell you, the VA that I'm experiencing today, I'm in the VA myself, compared to what my grandfather had to go through and my wife's grandfather, who's 102, he's finally doing his first claim. After telling him years and years and years, you know, some PTSD, hearing, of course, and so forth. There are a lot of veterans out there. I'm surprised how many I go out. I was in Chicago a couple weeks ago, and I saw a Vietnam hat. Went and talked to their veteran. They weren't in the VA system. I started asking some questions. Could I tell? Had a limp and all that stuff. And again, the story is, I don't trust the VA. Well, we're doing a better job at gaining trust, but I'm really concerned about this younger population as well. We don't want to lose that population. We as a nation we did not treat our veterans the best how they should be treated when they came back from Vietnam. We've done a better job. We've learned some lessons there, but there's much more we can do at one team, one fight. They fought for us, so we're going to fight for them. Next slide, please. almost done here. This just shows down Colorado, Alamosa for an example. And one thing I want to do highlight here is the unique patients. If you take the unique patients divided by your veteran population, you're going to get a percentage of veterans that are in the system. So they have a real high percentage of veterans in the system. You can look at that for La Junta as well, VA, GES. And then we target those areas with our county veteran service officers to get that number up. Next. We're getting near the end here. This is another money slide. We have two grants, the Veteran Trust Fund, and that's for congressionally chartered veteran service organizations like the American Legion right here, this gentleman. DAV, also VFW. We can also use that money for community living centers, also for the veteran cemetery, or any costs incurred by the division. Some of the challenges we have is we only have a limited allocation that we can spend, even though we have more money what we call in our savings accounts. Because over the last 20-some years, as these grants, if the grant money's not used, like last year, because coming off of some of the COVID and some of our veteran service organizations, it's volunteers that aren't really skilled and trained in how to run a grant. Things happen and like one person gets sick, the grant doesn't get funded, we have like $100,000 come back into this pot. So what we're doing now is asking the state for what we call continuous spending authority. So any additional money we have in there, we can spend to help veterans. Because last year we had over $450,000 in requests through our veteran assistance grant that we weren't able to fund because we didn't have the authority to go in and spend it. So we looked at that, identified that as something we can do to better serve our veterans. As you can see, that's about $1.7 million between the two grants. The veteran assistance grant. Rick, do you have any VAGs here in the county?
No, I have the BPM.
The BPM, okay. And you will find a lot of counties that will have the VAG, that can be a government agency, entity, and for transportation, for other services to assist veterans in a variety of different areas, as you can see right there. Go off for the grant money. We're going to try to expand this. One thing we're going to be doing different next year, in the past, we weren't able to use administrative costs for our grantees. So they were doing it free and they were volunteers. So we're going to, it looks like it's going to get approved going this direction, and we're going to be able to allow grantees next year to have 10% administrative costs. That's going to allow some to go ahead and come and join us. See these smiles there. This is long overdue. The other thing that we're trying to do is this is going to require a statute change in Colorado Revised Statute, which is our law, is we're only able to spend 5% to manage these grant programs. Now, typically, anyone in the grant business will know it's about 25 to 30 is about the top that you want to manage in the grant world. Well, we have 32 and 23, so that's 50-some. Using my Chicago public school math, trained me well. We're looking at getting that number raised from 5 to 10%, which is about the average of what we see in many grant programs. That will allow us to bring on another grant individual to help reach out more and provide services, especially to our VTF and a lot of those mom and pop type. They're 1D, they have a great heart for serving veterans, but we can go ahead and help coach, teach, and mentor them to make sure they can maximize the use of the resources that they give to the grants. Next slide. And this is just a submission. So in December, they're announced, you have 3 months to come back. There's training. We'll do some one-on-one training with anyone that needs technical assistance. And if you have ideas, get with Rick here. Rick is your county veteran service officer, and he has a couple counties that he.
I'm also a BPM grant administrator.
Okay, there, right there. And what is your grant for, Rick?
It's for transportation.
Okay. Transportation is key, especially in the rural counties and areas, to get them to the appointments. Very, very key. Next slide. Here's the cemetery out in Grand Junction. It opened up. We're celebrating our 20th birthday here in another couple weeks, and we're excited. First year we had 138 interments. This past year we had 440. So we're asking for additional groundskeeper and additional admin to help run that facility. We think we're going to be successful with that. No charge for our veterans, and I'll tell you, this is a beautiful place. I go out there just to ride the tractor. If I don't put in one in the street like I did last time, I do a recovery operation. So they give me permission to ride the tractors. We do a lot of events out there this is the final from cradle to grave of honoring our veterans. And if you're ever out in Grand Junction, stop by and visit. This is an incredible resource that we have for our state, for our veterans. Next slide. Here's the one source. Look at this facility. If you would have seen it before, if you ever been out there, it looked like it needed to be a bulldozer. And this is your Colorado State tax dollars going in to help serve veterans, and they do a great job. We want to replicate something like this in the southeast. We're really work hard on that. You can see we've got the leaders there and what they do, a wide variety of services and assistance to our veterans and their family members. Everything from, I don't think we do go yet, but we do some kind of. You see this welcome, valued, respected, and heard? That's kind of the vision. We want all the veterans we serve and our staff to feel welcome, valued, respected, and heard. And that's why it's important. I appreciate Director Kilmer offering for us to come out here, and he said, you bet. We'll be with our big brother every opportunity we get out here and speak with veterans and those that love veterans. We're on the same team. We're on the same team. Even big VA. We're on the same team. Politics gets more difficult the higher we go. But we're on the same team. So let's make a difference in our communities. And the next slide is some contact information here for our operations. Either of those two locations, either in Grand Junction or Lakewood. And property tax exemptions is another big thing we help out with as well every year for those that are qualified. And then appeals, I'll talk appeals. And then you can contact me in the next one, get you my personal information. And you can, next slide. And that's my personal number, so give me a call. I'll be more than happy. We work 24/7 because our veterans, when they're deployed, they work 24/7 protecting their freedom. So having served for 33 years, my son is in the Navy. He's been in 7 years now. A lot smarter than me. I'm Buddy Boots G.I. Joe. He was ran a nuke program, so that's smarter. So he's now off to Abraham Lincoln. He is in Guam, joint life. So with that, any questions you have that I might be able to answer from a state perspective, or I'll shoot back over to our big brother here. Yes, sir.
Is that cemetery in Grand Junction, is it also eligible for your spouse?
Yes. We have many spouses there. We have the columbariums with the urns, and then we have the double vaults as well. So, yes. Any other questions? You're getting off easy today. Matt, I should have brought my stripes so you yell at me. Okay, well, with that, I'll turn it back over to Director Kilmer.
Thank you, Dave. So I just want to take a moment to and ask our local VA staff if you stand, our local VSOs if you stand. So these are our local staff that are the boots on the ground between the state and the federal system. They are a part of the community and they are invested in our mission as well. So thank you for what you guys do every day. I know you guys are out here on the ground while we're up in Denver, but I just want to say thank you for your service. So. Just saw Leroy, sorry I failed to mention you earlier, a partner from BBA. So thank you so much. And is the chief back online or is he outside? So if you have a chance to see the mobile vet center outside, feel free. The chief is out there. I think it might still be open, I don't know, but it's pretty cool to see that. So again, earlier I had asked if any of you had seen this before, and no one has. So our commitment to you going forward, because we need to rebuild trust in especially our rural communities, among all of our veteran communities. So we're going to be out here, and this is our first week out in this format in Eastern Colorado. But our goal right now, I don't see it changing, is to come out at least twice a year in this format, bringing our support teams from Denver out to help the local team in processing. Because like right now, Dana, for example, she shared with me when I came in that the resource fair started at 2:30 today, and she shared with me that today she has helped more people combined from our last 2 days in Lamar and La Junta. That was really impressive. So, yes, last night it was very busy in the evening at the town hall. But today it was interesting because we had many more people come in throughout the day starting at 2:30, and they were able to provide one-on-one service. And in most cases, they're able to directly enroll. We didn't want to give you a pamphlet and walk away. So Dana, for example, is working on directly enrolling people in healthcare, getting them engaged. So that's a huge, huge win. In our community care team, they were, they all have their computers up. Everyone was like directly engaging access and services. So thank you for stepping away from your families and coming out on the road with us for this week. But we will be bringing them out and others. I think we need to expand and invite our geriatrics team and maybe our state nursing homes to talk about the benefits and service for our geriatric population. And because it's about all of our veterans. We serve all who serve. So, but our goal, hopefully you'll see this is a way that we're moving towards making it easy, efficient, and connecting with you. Next quarter, so I will be out. My goal is to be out to visit every clinic within at least once a quarter. The next quarter I come out, and I believe David's going to be traveling with me because we both have different but similar missions and people to meet and see. But next quarter, my goal is to bring our community care team out so we can go directly meet with all the healthcare leaders while we also check in with the local team. But we want to check with all the local healthcare leaders just to learn how we can better partner. Because we don't want to compete against our local community healthcare providers. It's a partnership. And through that open communication, if we know what they're dealing with, if we know where they're hiring, maybe we need to step up because it should be VA and community care. And then that way we can lift up the community together. So until next time we see it in this venue, but we will be out next quarter as well. So thank you so much for coming out. And if there are any additional questions, the team is standing by. So thank you.
With your Southeast Colorado news on seconews.org. The Senior Center wanted to mention they supplied the drinks and Little Caesars supplied the dinner from the Lana Senior Center for the veterans of Southeast Colorado. I'm Adrian Hart on seconews.org.